concerned for the future. I'm personally someone who's been vaccinated for measles, and I really stand behind that.
With rising measles cases in Quebec, Montreal health establishments like Notre-Dame Hospital here and Saint-Justine are once again requiring patients to wear masks to help combat the spread. A vaccination campaign is also set to begin in select Montreal schools on Monday. 21 elementary schools in the eastern part of the city will be part of the campaign, the health authority told City News. As of Friday at 2 p.m., there are 21 confirmed measles cases in the province, with 15 of them in Montreal.
I feel like it's necessary, especially to protect those who are more vulnerable. Masking really doesn't bother me, even as someone who has breathing issues after having COVID.
Vaccination rates have fallen, and so we have more susceptible individuals out there to get sick. If we had vaccination rates above 95%, we would not be seeing any measles cases because there would not be enough vulnerable individuals to get sick to allow for sustained transmission.
Measles is highly contagious. The virus can remain active for up to 2 hours in a room even after an infected person has left. It also has a long incubation period, usually between 10 and 14 days. Its symptoms include fever, cough, and a bumpy red rash. In rare cases, measles can be fatal. According to Montreal CIUS de l'Est, instructions for mask wearing apply to healthcare workers, patients, and accompanying persons, including children, and must be worn in places where patients can circulate, a practice welcomed by many. I don't know why parents are afraid of vaccinations. Some don't want to send their children, but they also don't want their children to be sick, so they've got to go.
I feel like the virus is then going to adapt, evolve, and we're going to have different strains of measles, and I don't really want to see that.
When I was young, we were vaccinated, so I understand people of my generation don't have to worry about catching measles. I would say that I certainly encourage parents who haven't had their children vaccinated to make sure they do it right now.
If we want to contain it, there are two big things that we can do to control the spread of measles. One is make sure people who are unvaccinated get vaccinated, because then they can't get sick, and to limit the transmission, because measles is so infectious. Anything that you can do to stop the spread, like isolating people who are sick and mask wearing, is obviously going to have an impact.
In Montreal, Anastasia Dextrene, City News.